Understanding your colon cancer pathology report, lymph node status. When you receive your colon cancer pathology report, one of the most important parts to understand is the lymph node status. This tells you whether cancer has spread from the original tumor into nearby lymph nodes. Lymph nodes are tiny, bean-shaped structures that help your body fight infections, but in cancer, they can also be pathways for cancer cells to travel. If your report shows that no cancer cells are found in the lymph nodes examined, this is called a negative lymph node status. It generally suggests that the cancer has not spread beyond the primary tumor, which is a good sign. However, doctors will also consider other factors like tumor size and location. If cancer cells are present in one or more lymph nodes, your report will show a positive lymph node status. The number of affected nodes is very important. If 1 to 3 lymph nodes contain cancer, this is classified as a lower stage, often called N1. If 4 or more lymph nodes are involved, it is called N2. Sometimes the report will specify exactly how many nodes are affected, such as N1A, N1B, N2A, or N2B, depending on the number of positive nodes. The more nodes involved, the higher the chance that the cancer has spread, which can influence treatment options. Sometimes, very small groups of cancer cells, called isolated tumor cells or micrometastases, are found in lymph nodes. These are smaller than typical metastases and may be reported separately because they can impact staging and prognosis differently. The pathology report will also mention how many lymph nodes were examined in total. Usually, doctors aim to check at least 12 nodes to get an accurate picture of spread. Examining more nodes increases confidence in the staging process. The presence of cancer in lymph nodes often indicates a higher risk that the cancer has spread elsewhere in the body. This information helps doctors decide whether additional treatments like chemotherapy are recommended after surgery. The report might also note lymphovascular invasion, which means cancer cells have invaded lymphatic or blood vessels, suggesting a more aggressive disease and a greater chance of spread. Lymph node involvement is a key part of the TNM staging system used to classify colon cancer. This staging helps predict outcomes and guides treatment decisions. Understanding your lymph node status gives you a clearer picture of the extent of your disease and what steps might be next. Always remember, each person's situation is unique. It's essential to discuss your pathology report with your healthcare team, who can interpret these findings in the context of your overall health and treatment plan. They can explain what your specific results mean for your prognosis and help you understand the best course of action moving forward. This information is based on current medical standards and research, and your doctor is the best resource for personalized advice.